There are at least two important challenges for anyone looking for research evidence about health information that address topics that are most relevant to them. The overwhelming volume of research evidence that's available online, and not knowing exactly how high quality this research evidence is when you find it. This makes it a real challenge to find and use relevant, high quality information. And it also makes it difficult to tell which results from research you should trust.
Welcome to Module 3 in the Finding and Using Research Evidence, a Guide for Citizens course. In this module, we'll focus on patient decision aids. There is a lot of information available to patients who are asked to make decisions about their clinical care, but most of it is not packaged in a way that supports them to make the most informed decision. It is becoming increasingly common for patients to play a more prominent role in decision-making about their own care. While in the past, healthcare providers often told their patients what they should do, nowadays they often provide them with a range of options about what they could choose to. And this is used to help them choose from the best options about how to age optimally, live well with their conditions, manage diseases, or make specific treatment choices. Patients often need additional information to support them in making decisions about which care options are the best for them. But many of the sources of health information available to them have not been designed for this purpose. To overcome the challenges we just mentioned, patient decision aids were developed to support patients to make informed choices about their care options alongside their healthcare providers. Patient decision aids help patients to make choices about their care by making explicit the decision that needs to be made, providing information about the options and outcomes associated with these options, and by helping them to clarify their personal values and how these values might influence the choices that they make. Patient decision aids can help with the outcomes of the care choices available to citizens when they're uncertain. These resources can also help provide patients with a tool to work through how their own values influence how they perceive each benefit and harm associated with their choices. Some treatments, for example, may offer longer life, although they don't guarantee that this extension in life is the best quality. This means some people would rather not pursue it. Values are a particularly important input in treatment decision-making when patients and health providers are working together to make the choices that make the most sense for them. This is especially helpful when culture plays a huge role in making decisions about healthcare. For example, Indigenous ways of knowing may be required alongside the best available health information contained in patient decision aids to make a more comprehensive, holistic decision about treatment decisions. It's important to acknowledge that not all patient decision aids are created equal. Specifically, not all patient decision aids are based on the best available research evidence, not all are prepared in a transparent and unbiased way, and not all are presented in ways that make them easy for patients to use. The patient decision aids on the McMaster Optimal Aging portal are used to help patients quickly determine whether the resource is relevant to the choices they have to make and whether the information is high quality. Much like the web resource ratings we covered in the last module, the portal also ensures it's easy to browse or search for other resources on topics similar to those addressed in patient decision aids. When accessing patient decision aids on the portal, a quality rating is provided, a summary of the patient decision aid is provided, and links to the original resource are also provided.